Hi, my name is Spencer. I'm going to be giving an IM injection using the diazepam mod that you provided for me. So let's get started. Okay, so first, before I do anything, I am going to want to compare the provider's order to what I have in the MAR. So I can confirm that there's a provider's order for diazepam. It matches the MAR, so diazepam 10 milligrams IM every 4 hours for anxiety. There's a provider's order for that. Next, I'm going to see if my patient has any allergies. I see my patient has an allergy to NKDA. Next, I'm going to look up my drug in the drug guide. So I filled out this piece of paper. I'll just go over it. So the drug I'm giving is diazepam, and the trade name is Valium. The drug class is benzodiazepine. The patient is taking this medication for anxiety management. The physician's order is for 10 milligrams IM every 4 hours. The safe dose range for anti-anxiety IM injection is 2 to 10 milligrams every 3 to 4 hours as needed. Some priority nursing interventions. I'm going to want to monitor the patient's vital signs. I'm going to want to assess the IV site, and I'm going to want to assess for any dependence. Some priority side effects are respiratory depression, dizziness, drowsiness, and lethargia. Okay, great. So I'm done with that. Next, I'm going to wash my hands, and I'm going to head over to the med cart. Okay, so I'm at the med cart, and I am going to want to look at the MAR and make sure I'm selecting the correct drug from my patient's drawer. So I see on the MAR it's diazepam. I'm going to click and get out diazepam from my patient's drawer. So, boop, and it gave me this. So next I'm going to want to compare what I have in my actual hand to what's in the MAR. So I see that this is diazepam, 5 milligrams. The expiration date is October 1st, 2020. I'm going to want to just do my medication calculation. So the order is for 10 milligrams, and what I have is 5. So I'm going to be giving my patient today 2 milliliters of diazepam. I can also do the 9 right, so I can just verify that the time I'm giving it is 9 o'clock. The route is IM. I have the correct patient. I have the correct time. I am ready to go. Okay, so I have my medicine. I'm going to put on my gloves. I'm going to clean the vial for 15 seconds. And I have my needle. For an IM injection, it's necessary to use a 1-inch needle, 22 to 25 gauge. So I am using this, what you probably can't see. It's 22 gauge 1-inch needle. So I'm going to put in 2 milliliters of air into the vial. So I'm going to remove my cap, put it in, and I'm going to inject the 2 milliliters of air. Next, I'll flip it up and draw out 2 milliliters of diazepam. I'm going to make sure I don't have any air bubbles. No air bubbles. Now I'm going to I'll put it here so you can see. I'm going to do the one-handed scoop technique. Push that on, lay it down, take off my gloves, and I'll wash my hands before transporting this medication to the patient's room. Okay, so I'm bringing these to my patient's room. I'm outside the door and I'm going to go in. All right, knock, knock. Hi, my name is Spencer. I'm your nursing student for today. I have your 9 o'clock meds to give to you. It's 9 o'clock now, so perfect timing. And the only medication you have is one, diazepam. Before I get started, I'm going to wash my hands. I'm going to close the curtain to give us some privacy, and I'm going to put on some gloves. So I washed my hands, I closed the curtains, and I'm going to put on gloves. Okay, before I give you your morning medicine, I need to get 2 identifiers. Can you please tell me your name and date of birth? My name is Mr. Paul Simon. My date of birth is October 13th, 1941. Perfect. Thank you so much, Mr. Simon. I'm going to be giving you your diazepam today. Like I said, that's your anti-anxiety medicine. And I'm going to be giving that right in your shoulder. So it's called your deltoid. I'm going to be giving it 1 to 2 inches below your chromium process. And then I'm going to use a V to just kind of make sure I'm in the correct spot. So anywhere right here. Perfect. And I have this hot dog bun to do that. So I don't like hot dogs anyway. Okay, so I am going to clean the skin for 15 seconds, moving in an outward motion. And I'm going to allow that to dry. Okay, so that's dry. I never took my eyes off my medicine, by the way. And now I'm going to hold the skin taut like this. I hope you could see. Hold it taut like that. Ew, I'm getting crumbs everywhere. Okay, taut like this. Okay. Before I do that, obviously, I needed to take off my cap. Now I'm going to hold the skin taut. Okay. I'm going to be administering this medication at 90 degrees into the muscular layer of the skin. I'm going to go kind of fast because I don't want the slower I go, the more uncomfortable it might feel. Okay, Mr. Simon? So you let me know if you need me to stop, but I feel like you can do it, okay? It'll be very quick. All right. Let me put my camera up. Okay. Oh, sorry. I am not holding the plunger. I'm going to make sure I don't hold the plunger until it's in. Okay. I'm holding the skin. I want you to be able to see. Sorry. I'm injecting it 90 degrees. I'm going to hold that and then I'm going to press down, injecting it in. Remove it, and then I will take my hand off the skin. I will not recap this needle. I will put it in the sharps container. I'm going to put gauze on my patient's skin and apply little pressure. Okay. I'm going to remove my gloves. I'm going to wash my hands. Okay, Mr. Simon, that wasn't so bad. You did a great job. I just want to make sure that you're comfortable. Is there anything I can get for you? No? Okay, fabulous. Well, here's your call bell. You let me know if you need anything, okay? And we'll see you a little bit later to check on you, make sure your medication is working, no side effects, and have a great day. All right? And then I'm going to document that I gave the medicine. I feel good.